We're here with Dr. Christopher Doe, founder of Zygotherapy. Dr. Doe has developed a unique treatment to increase muscle mass and strengthen in elderly patients while reducing pain. Dr. Doe, can you share with us what this treatment is and how you came about it? Okay.
Thank you very much, Amy. I've been in private practice for over 25 years now, and I've seen so much. In primary care, we deal with all sorts of problems from A to Z, and we try to treat as much as we can, and the ones who need special help, then we send to a specialist. I found that over the years, many things are treatable, but there's a couple problems that I have not been able to tackle very well. So the first part of your question is that for patients with chronic pain, pretty much I see 5 to 10 patients every day with some sort of pain. In America, we have over 65 million Americans with chronic back pain. That's estimated, and it's just going to get worse as the baby boomers get older. In the past, there were not too many treatment modalities except regular pain medications and maybe physical therapy. My opinion on physical therapy that it does help to some extent, but it's very dependent on the patient. If the patient is motivated, strong enough to do all the therapy exercises as recommended, there's a small chance it would help. I give it about maybe 10% of patients that I send out for therapy come back with results. Those patients may have relief for a while, but after time, they tend to deteriorate just like everyone else. The next step in the treatment of chronic pain usually involves injections. Once the therapy does not help anymore, I may look for pain specialists who can do either epidural injections, where they put a needle in the back of the spine, just like when you're delivering a baby. They put steroid medications in hopes that the steroids would reduce inflammation of the spine. Unfortunately, the results are variable. If in a good patient, they may see reduction up to 50%, but it only lasts a few months, typically 3, 4, 5 months, and the medicine dissipates and the pain comes back. They may get a second injection, but as time goes by, we find that the injections do not work any longer. At that point, we have to choose what to do next carefully. I would increase more pain medications in hopes that patient can just get through the day. The therapy patients typically stop going because they see no much benefit. And once they hit a certain level of medications, the side effects start kicking in. Typical side effects are drowsiness. A lot of them cause stomach irritation. They can even get GI bleeds where they have an ulcer in their stomach. Our last resort, when the pain is so severe, we have to use narcotic medications. These tend to have more major side effects, such as more drowsiness. But what we worried about in elderly patients is addiction. In the beginning, they're fine with it, but as the pain increases, they tend to increase their level of tolerance, and then they have to increase their dosing. At this junction in America, drug overdoses has become a top leading issue for many politicians because there has been a doubling of overdoses and deaths in the United States. There's more than 100,000 deaths per year so far, double than what it used to be 2-3 years ago. And because of that, many of the politicians have decided to change regulations where it's getting more and more difficult to get these narcotic medications for patients. I've seen various pharmacies deny these prescriptions, and the patients have nowhere to turn. They shop around for multiple pharmacies and do not get their pain medications. So in the end, medications has their limits because of side effects and addiction. And if that fails on management of their pain, we end up recommending surgery for the patient. Surgery, again, is not a cure-all. It is, at best, 50-50. So when I do decide to recommend surgery, I tell them the truth that if the surgeon does do the procedure, you would have, a decent chance of recovery and improvement. But again, don't expect 100%. If you get 60, 80%, you're in luck. Typically, I would see 20, 30% improvement for about a year or two, and then the pain sort of comes back. I believe that when the surgeon fixes the spine, they only fix the major areas where it's defective. But a spine has multiple defects, not just one. So the problem is that the other defects get worse over time and the pain comes back. And the patient kind of regrets even doing the surgery in the first place. Let me give you some examples of patients who do end up with surgery. My latest patient, she had total 2 surgeries, one in her upper spine, one in her lower spine, because her pain was at 11 out of 10, as she explained it to me. After the surgery, I recall she had maybe about a 1 year where she did find relief. But after that, the pain came back just like before. And because the surgery was recently done, the surgeons don't want to repeat or repair what was already there. So she ended up just living with the pain, dosing herself up with multiple medications. She's telling me she's taking 10 different pills a day just for pain. Make her so drowsy, she can't drive. She can barely get up and walk to the bathroom at times. And she was miserable. A couple times we were talking and she kind of hinted that she did not want to live anymore. I didn't think that at that time she was going to commit suicide or anything, but she felt very depressed. She had nothing to live for, but I did remind her that she had a daughter who's in college, and at least let's see her through, finish college, raise a family or something like that. And so she's trying very hard to cope with that pain at that time. So again, surgery is our last option, but it's usually not long lasting. Over the years, I'm a kind of guy who always likes to look for new technology, new medications, new ways of treating all types of illnesses. I like to read the newspapers, magazines, internet, and whatever comes across I think can help the patient, I would utilize for my patient. So one day, this rep comes by, and we're talking about cosmetics, lasers, and all that. I wasn't so much interested in all that, but in the end, he did have this one device that was used to stimulate muscles. And this device was designed as a cosmetic device to make people look good, build muscles, build body, and it's for the young people. And right out of that meeting, I'm sitting here thinking, good, but not too many people need that. But I do have patients who are in chronic pain, who are weak, who just had surgery that might need something where they can build their muscles stronger. So the reason I bought into that device was this. I know that every time a patient goes to a physical therapist, one of the things that the therapist always focuses on are the core muscles. But I know that for myself, I've had back pain for 38 years. It's hard to exercise and do some of these treatments when you're in pain. When you do it, it hurts and you just want to stop and just rest. And imagine somebody with a 9 out of 10 pain, I'm only about a 3. But if they're a really bad pain and you tell them to move, to flex, I don't think they can do very much. And so that's why therapy is very limited in its success. And the machine, I was told at that time, does the exercises for the patient. Instead of them having to do squats, weights, bending, whatever, the machine in one session can move the muscle 54,000 times. I said, no way. It's never been seen before and done. And so I asked for a demo. I asked to try it on myself to see how I felt, to see, is this true? Lo and behold, they tried it on my body, and I did feel a lot better just after one 15-minute treatment. And so from there on, I thought about my family. My wife has chronic back pain. My dad has chronic back pain. I have chronic back pain. And so we tested on them. And again, they got the results that I was hoping for. They got reduction in pain. And from then on, it was just a matter of finding patients to treat.
So what type of result have you gotten so far?
Initially, I didn't know how well the machine would work. And so I chose certain patients with chronic pains, mild to medium. They got excellent results after 2 treatments, over 2 weeks. And because of that, they kept coming back regularly to keep doing the treatments. I have this gentleman from Milpitas. He is an owner of a restaurant. He said in one treatment, he got about 40% reduction in pain. After 2 treatments, he was able to walk upstairs freely without having to hold the rails. He was able to sleep. He liked it so much, he kept coming back week after week. Even though I recommended that he spread out the treatments, he seemed fine, but he said, no, I keep wanting to do this for a few more weeks. So because of those successes, I proceeded to find more severe chronic patients, patients who've undergone all sorts of therapy, treatment, injections, and even the ones who've gone through surgery and they're still suffering with major pain. So I want to see how far this device can go. I was amazed on the results, even for severe pains, the ones that everyone has given up on. Even the physical therapist would say to them, I cannot do anything for you anymore. They would tell me that. And when they come tell me that, before this zygotherapy, I would kind of say the same thing. I don't know what else to do for you. I'll just give you pain medicines and hope one day you'll get better. But think in my head, they'll never get better. They're just gonna get worse and worse to the point where they're gonna probably end up in a wheelchair someday. Okay? But now I have so much high hopes for these patients that they can almost live a normal life. I wouldn't say 100% pain-free, but I've seen up to 80% reduction in pain, from a 10 down to a 2. I've had patients who've taken 10 pills a day down to 1 pill a day. I've had patients in a walker, now they're walking with nothing, not even a cane. And so they're reporting this stuff to me. I'm happy for them. I just want to tell the world that this thing exists. It's not a gimmick. It is something that I find amazing, and I want people to test it, to try it, to see for themselves that this thing really works. You know, I don't like to overpromise, but from the results I've seen, I really haven't had anyone come back with chronic back pain and say, this thing didn't work. Okay, that's why I'm willing to give a money-back guarantee on this treatment. If it doesn't work, I won't take your money.
So what is the treatment like? Does it have any side effect? Does it hurt? Or is it for everybody?
I feel that the treatment is pretty much 100% safe. I researched the device, how much energy it gives out, and the amount of energy is so minuscule, it does not affect any part of the body. Even if you have a pacemaker, any medical devices in your body, the energy that it produces doesn't affect those at all. I've tested on very old people in their 90s. I've tested in younger people, and the toleration level depends on the patient's levels. So the machine you can adjust the energy level as much as the patient can tolerate. So during the treatment, the trained technicians interact with the patient constantly, asking them how do they feel. Can we increase the energy at some point? Because we want to maximize the results, we have to push the energy to make the muscles work. So the patient tells us where to increase and where to stop. So the tolerability is variable, but everyone feels pretty good right after the treatment. Like me, afterwards, I felt like I was in the gym for a few hours, working out. I feel energetic, I feel tingly all over, and it feels good.
So is this treatment only for the elderly or for any younger generation that you have in your...
It's great for everybody, but let me tell you about the young people. They usually their muscles regenerate very fast. They will probably get a faster result than an elderly patient who has also some nutrition problems. So in a young patient, typically I would say post-surgical, let's say they had a knee replacement and they need a lot of rehab where they need to exercise the muscle groups. This would be a great option. Instead of going to therapy for 2 months, 3 months, you can speed this up tenfold. You know, just a few sessions is equal to 2 months of physical therapy. Let's say the patient had a recent back surgery. Again, they require a lot of physical therapy for several weeks, 6 to 10 weeks. Again, we can shorten that by doing 2-3 weeks, and they'll get pretty much the same result. So I think in the future, post-surgery therapy, this is the way to go. No need for conventional therapy where it's dependent on the patient. Again, when they're in pain, they do very limited activities. So the machine does all the work for them. If the patient wants just to look good cosmetically, they can do that, such as young bodybuilders. I can even apply this to athletes who are injured, who needs quick therapy to rebuild their muscles, or even before a game or sports, they just want to get that edge. Come on by. I'll build the muscles up before the game and they'll be stronger very quickly.
So when you say build muscle, how long will it take to build that certain muscle that we're asking for or looking for?
The speed at which the muscle builds depends on a couple factors. The main one is continued activities. Younger people tend to stay active daily, and that tends to build muscles faster. The studies show that after 4 treatments, the muscles increase about 30% in muscle size. In an elderly patient, although you could accomplish the same feat, but nutrition plays a big factor too. They have to eat enough proteins in their diet. That helps the muscles build, but nutrition is critical, and if they don't eat right, it just takes a little longer, but we still see pretty good results for all our patients.
So is there any downtime for this treatment that you're doing?
No. As soon as they finish, the patients get off the exam table, put on their clothes, walk home like nothing happened, but you feel like you went to the gym and you feel tingly, you feel pretty strong. Yeah, no downtime at all, 0.
So what does exactly this treatment does to the body?
Well, the machine has these pads where you put on these muscle groups, and they circulate this electricity through the muscles in various patterns. causing the muscles to twist and turn, to expand, contract, and multiple times per second. So that's why in just 45 minutes, the data shows that they've worked the muscle about 54,000 contractions.
So you basically saying that you can help all kind of people who's like in walker, cane, wheelchair, with this device with this device for this treatment?
For the most part, there is a small subset of people, I'll tell you a little bit, that it might not work so well, but anybody who is frail, whose muscles are weak due to aging, due to immobility, some patients just don't exercise, and I've had a few who have been in and out of the hospitals for various reasons, but each time they get out of the hospital, they're even weaker because they are made to lay in bed most of the time, 24/7 while they're in the hospital. And they come out to a skilled nursing facility to get some rehab, but the rehab doesn't really work very well because 23 hours they're laying in the bed and they get therapy for 1 hour. So they end up pretty weak. Even if they're bedridden, I feel that the machine will benefit. It may take a little longer for the severe patients, but it has to work because the theory behind it works. We're building the muscle without having the patient actively participate. The machine does all the work, and when the muscle gets stronger, they will get stronger. There's just one caveat that if patient has a major stroke, a severe stroke, I've tested on a couple of stroke patients. The reason it did not work so well because there's a disconnect between the brain and the muscle. Although I'm building the muscle, it's getting strong, but there's no one controlling it. So if your stroke is mild where you can still move the extremity, the arm, the legs, there's a good chance you'll respond. But if you're pretty much paralyzed where you can't move any of your extremity, I don't think this will work for you. So only that subset I found has not worked. But for everyone else, I've had 93-year-olds, I've had patients who are bedridden for a couple years, I have patients on wheelchairs, walkers, you name it, they've responded to the point where the family's happy, they keep coming back, and I think that I can keep these patients living this level stronger for years. Because let me tell you, if patients get to the point where they're in wheelchairs and bedridden, they will develop other complications, bed sores, they'll get sick, infections, they will get multiple problems, they'll end up in and out of the hospital, and they will die much younger. So by keeping them strong, I think we can make them live a few years longer.
So how many treatments on these patients are to get this some kind of result or some result?
Good question. It's a little variable. If you're mildly weak, I would say 2 to 4 treatments, you get pretty good results. If you're kind of medium weak where you're in a walker mostly, I would say 4 to 6, give it 6, and you would start seeing results where you can probably get rid of the walker. If you're more severe where you're pretty much in bed all day, can't really stand at all, but you can still move your arms and legs, give it about 6 to 8, but more like 8, and we can probably get you out of bed. You got to give your body enough time to build the muscle. In between treatments, if the patient is also active, they recover much faster. For the bedridden patient, even after treatment, they're still laying in bed, not moving at all. So it's going to take some time, but I've had a couple patients like that, and I've had success where I was able to get them standing. They're not walking by themselves yet, but with a walker, they can walk with it after 8 treatments. So the treatments must coincide with good nutrition, and the family has to continue to encourage the patients to stay active. I do have a couple patients that believe that the machine is all they need. Once they do the treatment, they go home, they do nothing else. They sit there 24/7 in front of the TV. So the results are slower. Even though there is results, some family members think that, this is not what you told me. I said, well, I told you from the beginning that you have to push the patient also. You can't just depend on one thing and let this machine do everything. No, the patient has to participate. So let me compare the conventional treatments without this device, Zygotherapy. Like I told you before, my patients who were in and out of the hospital, every time they're in the hospital, they get physical therapy. When they come out, they go to a skilled nursing facility, they get physical therapy. But then when they go home, they're weaker than before they went in. Why? Because again, physical therapy is not a magic cure. It depends on the patient's participation. The therapist tells them how to exercise, what to do, the methods, the machines. Here, buy this machine, you do this, you do that. If the patient's too tired, too much pain, they're too not motivated, it doesn't work. The treatment is so variable that I've sort of lost confidence in it over the years. I tell my patients this example. I ask them to do a squat. How many can you do? Most patients, 10, 20 the max. Some can't even do 2. But I tell them, look, one session of psychotherapy is like equal to 50,000 squats. Who can do 50,000? No one. I can do a couple hundred, but over one day. But imagine the muscles working out 50,000 reps in 1 hour. That's why you get the results. That's why the muscles build so quickly. Even the bedridden patients, after therapy, over time, they'll be able to get out of their bed, stand, and even walk a little bit. If the patient continues therapy over time, all I can see is that they will get stronger and stronger until they're fully functional. One of my greatest results was my first patient, Mr. V. He came to me and his wife. He was in a wheelchair. His mind was clear. Everything else was working fine, but he was so weak, he could not stand without assistance. His wife had to work full time, so she had to leave him at home by himself 8 hours a day. He would tell me that he couldn't cook. He would eat whatever's around the kitchen. Going to the bathroom was difficult. Sometimes he would just hold it and wait until she got home. They were not a very happy couple because of his frail health, and they had no children that could physically help them with activities of daily living. When they came to me, luckily, I was starting out Zygotherapy. If they had come to me 4 months earlier, I would just shrug my shoulders and say, Mr. V, go do more therapy, exercise. I don't know what else to do for you. But since I had this tool and I felt that it would help him, I asked him, try it out for me. I want to see how it can build your muscles. Lo and behold, 1 week after he came, his wife wheeled him into the room. I saw him get out his wheelchair. He walked to the table without help. I said, I said, well, maybe it's just coincidence. I don't know. He came back the second week. I didn't see his wheelchair. So, where's your wheelchair? He came in with a cane. After the treatment, he walked from the back room all the way to the waiting room, which is about 80 feet, by himself. On his 5th treatment, I didn't see his wife. I said, who brought you here? And he says, I drove myself. I said, no. Who brought you here? I drove myself. I didn't believe it. And I went down, took a picture, and yeah, he drove himself to the office. And so now he's able to live, take care of himself. His wife works. She doesn't have to worry about him. He's even talking about going on vacation. The last few years, forget it. Him and his wife are looking to go to Vietnam to relax and enjoy. First time in his life that he felt good.